produces, stores, and secretes bile needed for digestion. Bile is a thick, green, brown, or yellow liquid produced by the liver and helps digest fats. The liver produces approximately 1 liter of bile each day. During a meal, bile is secreted directly into the intestine. When not eating, it is stored in the gallbladder until it is needed. The gallbladder, located at the right upper quadrant of the abdomen just beneath the liver, does not only store bile, but it also concentrates it. It typically holds around 30 to 19 milliliters of bile. It contracts to release bile into the small intestine when fatty foods are ingested. Gallstones, medically called as cholelithiasis, are hard concretions made up of cholesterol or bile salts called bilirubin. The cause is unclear, but several factors increase the risk of developing it. These are being female, age of 40 years, excess weight, and eating a high-fat or high cholesterol diet. People suffer from gallstones usually do not manifest any symptoms until a gallstone blocks a duct and causes pain. When untreated, complications can occur. Common symptoms are nausea, vomiting, sudden pain located at the right upper area of the abdomen that can intensify quickly. Pain may radiate to the upper right part of the back. Pain occurs after a meal frequently in the evening and may last from minutes to hours. A gallstone, when expelled out of the gallbladder, may get stuck in the common bile duct, resulting to a condition known as choledocholithiasis. The common bile duct is the passage of bile from the liver to the small intestine. When this duct is obstructed, bile backs up to the liver, causing nausea and vomiting, jaundice or yellowish discoloration of the eyes and skin, tea-colored urine, and clay-colored stools. Since surgery is usually the treatment of choice for these conditions, we have devised a less invasive and less expensive approach. Here is our natural method for removing gallstones. First, prepare the materials needed for the procedure. These are fresh apple juice, Ionique mineral drops, 60 ml, purified drinking water, extra virgin olive oil, fresh grapefruit juice or fresh American lemon juice, measuring cup, used or old colander or strainer. Here is the procedure. On days 1 to 5, take 250 milliliters of fresh apple juice with 10 drops of Ionique mineral drops every 2 hours from 8 a.m. to 8 p.m. That will be 7 glasses in all. Drink purified water only as the beverage throughout the day. Other beverages are not allowed. Eat regular meals, but avoid fatty foods because it is important that the gallbladder be filled up with bile. Fatty foods include sautéed foods, fried foods, meat, poultry, fish belly, and any form of oil, animal or vegetable oil. On day 6, stop all medications, food supplements, and pills. Have regular, non-fatty foods until 2 p.m. No food or drinks allowed after 2 p.m. At 6 p.m., take 500 ml of purified drinking water with 40 drops of Ionique mineral drops. Repeat this step at 8 p.m. At 9:30 p.m., prepare 120 ml of extra virgin olive oil and 180 ml of fresh grapefruit juice. In the absence of grapefruit, one can substitute it with 120 ml of fresh lemon juice. At 10 p.m., mix the extra virgin olive oil and the fresh grapefruit juice and drink it within 5 minutes. For weak and elderly individuals, they can take the mixture not to exceed 15 minutes. When lemon juice is used instead of grapefruit juice, it is best to drink them separately because when extra virgin oil and lemon juice are mixed together, the mixture becomes thick, sauce-like solution, and difficult to swallow. Before the 10 p.m. step is undertaken, do all the chores, including bath and urination. Lie down on the right side immediately after the intake of the solution and remain at that position for at least 1 hour. I reiterate that it is very important to lie down on the right side immediately after the intake of the solution. Failure to maintain this position may prevent complete elimination of the gallstones through the ducts and may also cause complications when a stone gets stuck along the duct. It is recommended that you sleep after the intake of the mixture. On day 7, at 6 a.m., if not nauseated or dizzy, take 250 milliliters of purified water with 20 drops of Ionique mineral drops. If nauseated or dizzy, wait until the feeling disappears. At 8 a.m. or 2 hours after drinking water with Ionique mineral drops, take 50 milliliters of extra virgin olive oil and 70 ml of fresh grapefruit juice, or 60 ml of extra virgin olive oil and 60 ml of fresh lemon juice. This will eliminate the residual stones left in the gallbladder unless they are very numerous. At 10 a.m., take 250 ml of purified drinking water with 20 drops of Ionique mineral drops. At 12 noon, take 500 ml of plain purified drinking water. At 12:30 p.m., take few pieces of fresh fruits. At 1:30 p.m., you may have light, non-fatty meal. Regular meal is allowed at supper, but avoid much fatty foods. Day 7 is also the day when the gallstones will be passed out together with the stools. When defecating, place a used colander or used strainer on the toilet bowl to catch and collect the gallstones as specimen or as proof that there is a natural method to eliminate gallstones aside from surgery. Flush out the feces in the colander or strainer before collecting the stones. The gallstones may not appear on the first defecation for the day. Other individuals may pass out the gallstones out in the evening or on the following day, so just search for them. There are individuals with multiple gallstones, some more than 100, that are not seen in the ultrasound report. The procedure flushes both the liver and the gallbladder. It is recommended that ultrasound of the gallbladder be done before and after the procedure as proof of the effectiveness of this natural gallstone removal. If gallstones are still present, repeat the entire procedure after 2 months. Others may require several procedures to eliminate the gallstones completely out of the liver and the gallbladder. The largest gallstone removed through a similar procedure was size of a golf ball. Please read and understand the procedure thoroughly before implementing it, because failure to follow the procedure properly may cause drastic complications that may result to surgery. Where one Rev Enterprise waive any responsibility or liability should any complication arise from the improper implementation of the procedure. If the individual is jaundiced, please seek advice from a medical professional before implementing the procedure. The patient may have other reasons that cause the obstruction of the gallstone along the biliary duct. We have devised the above procedure to remove gallstones naturally and spare the gallbladder from unnecessary surgery. The body requires gallbladder to store bile necessary to help digest the fats ingested. If the procedure helped you remove the gallstones, please share the procedure to others too, so they may also benefit from the procedure. When blessed, please share your blessings with others. At this moment, I extend my most sincere gratitude to all of you for taking your precious time watching and listening to this video presentation. Should you need any clarification, please visit any of our branches and product distribution outlets or send message to Facebook Ionique Minerals Philippines. Our staff will be more than willing to assist, clear out your doubts and queries regarding your medical concern. Until our next meeting, may the good Lord be with you always. Once again, I am Dr. Renato Paragas, the Water Doc.
So thank you for the first video. Again, we will pause for 5 minutes